Warm greetings to one and all. I'm Dr. Parisa, Associate Professor from the Department of Pediatric and Preventive Dentistry, Meenakshi Ammal Dental College and Hospital, Mahar. The topic for my today's lecture would be rubber dam isolation in pediatric dentistry. It would further be discussed under the following headings. Rubber dam isolation is one of the most important isolation technique in field of clinical dentistry and at the same time the most neglected one. So rubber dam was introduced initially by Barnum, who was a dentist practicing in New York in the year 1863, and it's still date the gold standard of care in endodontic practice when it comes to isolating the operative field. It's often known as the raincoat for the teeth in the field of pediatric dentistry. So why do we need to use rubber dam? So the main goal of using rubber dam is isolation, and main goals of isolation are moisture control, safe working field, aseptic operating field. It prevents accidental ingestion of foreign materials and instruments, prevention of salivary contamination, and better visualization for the clinician. So what are its advantages? Safety, moisture control, and better patient management. The disadvantages are incorrect usage of the rubber dam could cause damage to the crowns and gingiva. Insecure clamps can be ingested. It's time consuming if the clinician is not well versed with placing the rubber dam. It's expensive, and if placed improperly can cause blockage to the airway. Contraindications are in asthmatic patients, mouth breathers, extremely malpositioned tooth, partially erupted teeth, patients with latex allergy, and extremely uncooperative patients. So what are the armamentarium in rubber dam kit? It consists of a rubber dam sheath, rubber dam clamps, rubber dam forceps, rubber dam frame, a punch, and rubber dam accessories such as a lubricant, dental floss, and a rubber dam napkin. So what is a rubber dam sheath? Rubber dam sheath is the main one that's attached. It's a sheet that's attached onto the frame, and it carries the clamp along with it. And it is classified based on its size, color, sides, and based on its thickness. So rubber dam clamps, the next thing after the rubber dam sheet is rubber dam clamps. So rubber dam clamps are used to hold the rubber dam onto the tooth, and they are available in different shapes and sizes. And its function is to anchor the rubber dam to the tooth and help in retracting the gingiva. So based on their design, they can be classified into jaw design into bland and retentive. Based on presence of wings, it can be classified into winged and wingless. And based on the material used, it can be made of metallic clamp or a non-metallic clamp. So based on jaw design, we have bland clamps and retentive clamps. Bland clamps are identified by the jaws, which are flat and pointed directly towards each other. They grasp the tooth at or above the gingival margin level, and it's used in fully erupted tooth. The retentive clamps are nothing but the jawed clamps, which has jaws, and they are directly placed onto the tooth, and they are placed gingivally, and they grasp the tooth from the cervical area. They have a 4-point contact, which should not extend beyond the mesial and distal line angles of the tooth. And if not placed properly, it can result in rocking and tilting of the clamp. So based on the wing, we have winged and wingless, and metallic and non-metallic. The traditional clamps are usually made of tempered carbon steel and stainless steel. The problem is they appear radio opaque on radiograph. So there will be overlapping of the structure seen when you take a radiograph while you're doing a procedure. Next, armamentarium is the rubber dam forceps. It's used to carry the clamp onto the tooth. So we have handles for the forceps, which are compressed together, and it has two working ends which move apart. The working end has small projections that fit into two corresponding holes of the rubber dam clamp. The sliding lock device, which locks the handle in position when you want to carry the clamp into the oral cavity. And the tip of the forceps, which has grooves, which is difficult to remove once the clamp is in place. Next is rubber dam frame, which are available either made out of metal, which is commonly known as Young's frame, or we have the plastic frame. The plastic frames have the advantage of being radiolucent, and it's known usually as Nygaard Osby frame. The functions of it are, it supports the edges of the rubber dam. It's used to retract the soft tissue and improves accessibility to the isolated. Rubber dam punch is used to make holes on the rubber dam sheet through which the teeth can be isolated. The working end is designed with a plunger on one side and a wheel on the other side. This wheel has different sized holes on the flat surface facing the plunger, and the punch must produce a neat cut hole every time so it does not lead to accidental tear of the rubber dam sheet. Next is rubber dam punch. So we have the rubber dam punch has different holes based on the tooth that we want to isolate, whether it's a primary tooth or it's a permanent tooth. And for each tooth, there is a specific hole there and a specific size, which you can see in the image as described here. So you have for the primary teeth, you have for the second molar as described here, the B, C, and E. For the second molars, first molar, and upper and lower anterior teeth. And for the permanent teeth, you have for the lower molars, large upper molars. For upper molars and small lower molars, the C is used for canine and premolars. D is used, the D size hole is used for upper incisors, and E size hole is used to punch for lower incisors if you want to isolate that particular tooth. So you have a rubber dam template, which is it is an ink rubber stamp or a stainless steel template, which helps in marking the dots on the sheet based on which tooth you want to isolate. And the holes should be punched according to the arch and any missing tooth. Rubber dam accessories, usually a lubricant is used, a petroleum jelly is used, rubber dam napkin, which is placed beneath the rubber dam sheet and frame. And you have dental floss, which are tied to the rubber dam, which are tied to the clamps for safety, and you have wedges. So application technique, we have 3 application modes. So one is like you administer local anesthesia, select the clamp, select the rubber dam sheet, mark on the template, secure the clamp, place the clamp through the dam, and place the clamp and sheet onto the particular tooth, and fit and secure the clamp and apply the frame at last after stretching the dam over it. The next technique follows the same procedure. The basic procedure will be same. The only difference is here you will be placing the dam over the tooth, and then you will place the clamp, and then you will with a forceps and you will fit and secure the clamp, and then last you will place the frame. And the last technique, the third technique is you will, after administrating local anesthesia, select the clamp, the rubber dam sheet, make a punch using the template, secure it using a floss as the previous techniques. And then what here you will do is enlarge the hole in the sheet with the help of a retaining forceps and gradually adapt it to the retainer. After it snugly fits, you pull the sheet down completely over the wings and secure it with a floss. Then you apply the frame and stretch it over the dam. And then you cut any excess if there is in the anterior region where you feel that it's causing blockage to the airway. So as we know, we cannot use technical terms when it comes to children. We cannot explain to them that we are going to use a rubber dam. So euphemism is word that's used, an alternative word to the original technical term. So rubber dam here usually is introduced to children as raincoat. The frame is used as a hanger and the clamp is used as a clip. So the removal of rubber dam, before removing the rubber dam, you need to rinse all the debris and you remove any ligatures, and after that you need to stretch the rubber dam so that the dam's interproximal areas get loosened, and you need to cut it with a scissor. The clamp, frame, and dam are then removed as an entire unit. Inspect the mouth, so no small particles should be lying on the floor of the mouth, and then gently massage the tissue using either a local anesthetic gel or normal petroleum jelly, and then ask the patient to rinse their mouth. So we have advanced techniques in rubber dam isolation also, which are easier to use nowadays, like you have InstaDam, OptraDam, and Liquid Dam. Complications are associated with rubber dam are usually trauma to lips and gingiva, poor clamp selection, loss of springiness of clamp, pressure mark on the face from the frame. High dam can block the nasal passage, and worn out clamps can get fractured during the treatment. So to conclude with, the clinician should remember that the success of the dental procedure doesn't lie only in eradication of the pathological process, but also lies equally on the isolation of the operating field. And to achieve this in the first place, a safe and aseptic operative technique needs to be maintained. For this, application of rubber dam is mandatory, and it's the only sure safeguard technique where you can use it against bacterial contamination, especially now. It's very important to use that to prevent cross contamination during this pandemic. And you can prevent any cross contamination from saliva and accidental swallowing of any dental instrument, which is very important in children. These are my references. Thank you so much for your patient listening.